can be confusing, and here to help us understand Medicare and what you need to do to enroll is Tina Sabinsky, Medicare Health Plan Specialist from HMSA. Welcome, Tina.
Hi, Rachel. Thank you for having me.
Yes, of course. Okay, let's talk about it. We mentioned it's already confusing.
Yes.
But what's the most common question you get asked when it comes to those turning 65 and getting ready to retire?
Probably the most common question that we get is what happens when you're still working when you're 65? Like, people want to know if they have to sign up for Medicare, and they can. So when you turn 65, most people sign up for Medicare Part A because they or their spouse have worked in the U.S. for 10 years. So that Part A is premium free and it'll coordinate with their group health insurance. The question comes into, do I need to sign up for Part B? And the answer is that you can or you can't. It is whatever fits your lifestyle the best. Some people defer it until the time that they retire. Other people will sign up for it right when they turn 65 because it's more convenient. They won't have to worry about it later when they retire. But they do have to remember that if they're deferring, they need to sign up for Part B once they retire.
Okay, so Part A, Part B, I love that there are options.
Yes.
But for those who may not know or quite understand it yet, what is Medicare?
So first you have Medicare Part A, which covers hospital, and that's your hospital insurance. So that would cover, say, if you stayed in the hospital for a couple of days. Then you have Medicare Part B, which covers your medical insurance. That would cover things like your doctor's office visits or your labs. So Medicare Part A and B combined are considered original Medicare. Okay, then we have the third part, which is Medicare Part C. Now, those are your Medicare Advantage plans. Now, those plans are offered by private insurance companies, and they do cover everything your Medicare Part A and B cover, as well as your prescription drug coverage. Now, not all Medicare Advantage plans cover prescription drugs, so that's one thing that you want to check when you're researching the different plans out there. Now, Medicare Advantage plans can also cover things like vision, fitness, travel, dental. So those are all combined into one plan. Now, when you move on to the fourth and final part of Medicare, that is your Medicare Part D, which is your prescription drug coverage. Now, with your prescription drug coverage, it can either be offered as a standalone prescription drug plan through a private insurance company or as part of a Medicare Advantage plan. Those are the four parts.
Nice. Different for everybody.
Yes.
You know, each family, each individual has
Correct.
different needs. So love, again, that there are options.
Yes.
And if people want to enroll, when would they do that?
So there is whenever you're turning 65, you do have 7 months to enroll. So that starts 3 months prior to your 65th birthday, the month you turn 65, and 3 months after your 65th birthday. But we do recommend that people sign up early. That way they don't have any risks of penalties or lapses in coverage.
Gotcha. And then what should people consider when they're looking to choose what is right for them?
Well, as you mentioned before, you know, it is a personal choice. You know, you got to base those decisions on your lifestyle. Maybe what prescriptions you take to make sure that they're covered. You make sure your providers are participating with the plan. So there are all factors that you have to think of, the benefits that you use the most. So you want to look at all of those things, make sure they're covered, and make sure that you're confident in the plan that you choose, because ultimately that's what you want.
Yes, absolutely. And part of being confident is being able to do your own research. So
Correct.
if people needed more information, where could they get that?
Oh, there's so many resources out there. So if you want to know more about Medicare, I would recommend going to the Social Security website at ssa.gov, or you can go to medicare.gov for more information as well, and that's directly to Medicare. Or there is the State Health Insurance Program here in Hawaii. They're a great resource to have. They have a lot of volunteers that are very knowledgeable on Medicare as well as Medicare Advantage plans.
Nice. And if they wanted to talk to you folks at HMSA,
you can visit us at one of our neighborhood centers. We do have them statewide. So there are 2 on Oahu, 1 in Pearl City, and 1 on Keeaumoku Street. And there is also, we have the offices in Lihue, Kahalui, and in Hilo. So statewide, we want to see you. We want to talk to you. We also have workshops, which come see me. I would love to talk to you. I would love to go over Medicare, answer any of your questions, as well as plan information from HMSA if you want to know more.
Awesome.
So lots of different ways to do so.
Yes, Tina knows all about it. So go ahead and contact them at HMSA. And of course, all the information resources will be there on their website, plus ours as well at HiNowDaily.com. Mahalo for joining.
Thank you so much for having me.